This is Mark Newman from Precision Analytical. We're going to go through a quick case study of a male patient just to kind of showcase how complex these hormone pictures can be when you've got symptoms related to potentially a hormone deficiency like testosterone. So the patient picture here, it's a male patient, lots of symptoms of low testosterone. He's a little bit overweight. As we look at the hormone picture, we want to test because we want to know what's going on. We're expecting low testosterone because he's got symptoms of that, erectile dysfunction and some of those things. And you'll see a lot of commercials that say, hey, your problem is probably low testosterone. Well, if you look at this guy and he actually tests, this is a urine test here. The reference range for testosterone is 26.7 to 74 right there, and you can see his results 68.1. This guy is not testosterone deficient, but he's got symptoms of low testosterone. If you want to add some more tests, you can see he's making a lot of estrogen. Estradiol is your main estrogen, and where does that come from? It comes from testosterone. Okay, we don't want too much estrogen. That could lead to some symptoms that you're not going to want. Upstream of testosterone is DHEA. A common marker for DHEA is DHEA-S or DHEA sulfate. Now, that's a pretty basic look at your hormones. You can get that in any test. Basic hormones you can see in serum, you can see in saliva, you can see in a urine test. This test here that we call Dutch has a lot more information. This is a dried urine test for comprehensive hormones, Dutch. We don't just have your basic hormones, but we're going to show you an expansive panel of your androgens. Those are more your male-related hormones like testosterone, but there are others that we want to see. Estradiol is your main estrogen, but we want to add to that picture some of the other metabolites that can shed some light on that. We want to look at your cortisol picture. What's your cortisol doing throughout the day? That's important. Then we want to look at metabolized cortisol. We want to look at melatonin. All of these things could be directly or indirectly related to what's going on with a particular patient, and we want to look at all that information with this test. So the patients are simply collecting 4 times on this filter paper on these collection devices throughout the day. They hang them up to dry them in the bathroom. Once they're dry for 24 hours, mail them into the lab. It's really easy, but from that we can get a lot of information. Now, you don't need to follow all of the particulars of this, but I want to show you what information in this particular patient you could add into the picture to really expand the clinical picture for the healthcare provider to figure out what's going on with this patient. We saw that testosterone was normal. We saw that estrogen was high, and we saw that DHEA-S was low. Now, we've added to that picture the downstream metabolites of DHEA, which also reflect how much DHEA you have. And look at these. That one's pretty high, and this one's really high. So now we've got a little bit of a mixed message there, but those imply that there's actually quite a bit of DHEA being made, but it's not heading over to this common marker of DHEA sulfate. Let's add to the picture even more. Let's look at cortisol. That's your stress hormone, right? You get stressed, you got a lot of cortisol. This patient is high for cortisol throughout the first half of the day and then kind of normal in the rest of the day. Now, why is that important? Because cortisol can oppose the action of testosterone. You can have symptoms of low testosterone simply because you're stressed out and your cortisol is high. Now, we can confirm that. We're looking at more information. More is better. Cortisol metabolites. Those are the downstream metabolites of cortisol that really reflect, is cortisol really high? Are we really making a lot of it? Yep. Look how these are mostly above range. There's a lot of cortisol from this patient. Now, why? Now, here's where a theme starts to emerge. Stress raises cortisol levels. But you know what else does? Inflammation. Inflammation leads to high cortisol. Guess what else inflammation does? Inflammation inhibits sulfation. DHEA turns into DHEA sulfate, but not if there's a lot of inflammation. So we've got a lot of DHEA, but it's all heading this way. Why? Inflammation. What turns testosterone into estrogen? An enzyme. That enzyme's name is aromatase. The best way to make aromatase work extra hard and make lots of extra estrogens is by exposing it to prostaglandins. Where do you get prostaglandins? Inflammation. So inflammation is probably the cause of this. the cause of this, and the cause of this. So a theme is emerging when we have more information, and that's really important to get to the root cause of what's going on with a particular patient. Now, we can dig a little bit further, and again, you don't need to follow all of this, but your healthcare provider can help work you through this. This guy is getting a little bit older. We want to start thinking about prostate health. Well, guess what's bad for prostate? High estrogen. Now, how is he metabolizing that estrogen? This estrogen metabolite right here can damage your DNA, and it's been shown that that happens more in men who develop prostate cancer. So now we have two things going on that's not good for prostate cancer. You'd rather have the estrogen heading down this way, and look, it doesn't. There are nutritional things you can do to really turn that in a more favorable way, but not if you don't know the information. That's why we like all these extra tests. Now, when we're talking about prostate cancer, it talks about in this paper how high estrogens can cause that, but what else is helped by that? This testosterone metabolite called dihydrotestosterone, or DHT. Well, guess what? We're measuring that as well. DHT is above range, and it's not just above range, it's way above range in this case. So we've got three factors working against us. High cortisol is not going to help either. We've got high cortisol, high estrogen, high bad estrogen metabolites, and high DHT. Those are things we can all address by lifestyle, by nutrition. When we're looking at this big picture, we can really get to the root cause of a lot more issues that are affecting your health. So more information leads to better decisions. The dried urine test for comprehensive hormones is a great way to do that. If you think you have low testosterone, what should you do? Get tested. This Dutch test is a good way to go, but you can also use other tests. Serum testing might be better in terms of, a lot of the labs bill your insurance, and so that might be better in terms of just cost effective sometimes, but you get a little bit less information. Saliva testing is also going to be less information. It's probably less accurate, generally speaking, especially for females with testosterone. With the estrogen, it's really more accurate to test in serum or in urine, but those can be reasonable options, and they can be pretty cost effective as well. But secondly, work with a professional. That's why with our Dutch test, we offer that with a free doctor consult, because we know this stuff is complicated, and if you're going to get to the bottom of the issues that are hormone related, you need to work with someone who's an expert in that field. So we've contracted with some really sharp doctors to help you kind of understand what the results mean so you can take the next step. So if you think you're low T, or you think you have other hormone imbalances, get tested and work with a professional. If you want to get tested by using this dried urine test for comprehensive hormones, you could go to our website, precisionhormones.com, click on Get Tested, and that's a good way to go. We can just mail the kits to really anywhere in the world. It's a really simple collection. You mail them back to the lab, and that can get you a lot of information. But again, if you're going to get to the bottom of these issues, don't just go and take hormones and do things that are significant in terms of the level of intervention. It's better really to move forward with information so that you're making the best decision to give yourself the best outcome possible.